Well, chances are you know someone with diabetes, but even though it's been a little more than 100 years that insulin was discovered to help those with the condition, it is still one of the most prevalent and misunderstood diseases out there. Hi everybody, I'm Kendis Gibson, your host for today's discussion. It is coming to you from the Baptist Health Newsroom. And today, the number of people with diabetes is growing all across this country. It is higher than it has ever been, and many people are developing diabetes at younger ages as well. Here to talk with us more about it, along with those myths as well as misconceptions that drive the stigma surrounding all of it. We're lucky to be joined by two experts in the field from the Baptist Health and Miami Cardiac Vascular Institute, diabetes educator and registered dietitian. She's been doing it for quite a few years, she says. You don't look it. Amy Kimberlin, as well as Tatiana Mullins, who is a nurse navigator and also someone living with type 1 diabetes. Happy to have you both here, Tatiana and Amy. Really appreciate it. And a reminder before we get started and before we dive into everything, a reminder to our viewers that you can weigh in on this discussion as well. You can send in your questions in the comments area at the bottom of the screen. We're here for you and happy to answer any questions that you may have as a result of all of this. And it really is an important discussion. Let's start with the basics, Doctor. What is diabetes, and how do diabetics need to watch their eating habits and sugar levels?
Yeah, you asked a really great and important question, and so I guess I'll first start off with just the difference between type 1 and type 2. Type 1 is an autoimmune disorder, and so what we know is that the body is actually attacking its own kind of response with those cells being produced, and so at the end of the day, the pancreas is no longer producing insulin. And so again, it's an autoimmune disorder where there's a beta cell dysfunction, and at the end, no production of insulin. So we'll go into kind of the treatment in just a second. Type 2 diabetes is on the other spectrum where the body's producing insulin. However, there's some resistance. It either could be producing some and it's not responding, or the insulin it's producing is not actually working. So again, two completely different kind of paths of what we look at and how a treatment is, because in type 1 diabetes, they need insulin in order to survive since their body is not able to produce it. Whereas in type 2, we need to kind of address the insulin resistance.
And do we have a sense of which one, not more popular, but that more people have? Type 1 or type 2?
For sure. Type 1 is less prevalent. However, numbers have been on the rise. I don't know what the predictions will be, but right now it's about 1.6 million when I looked up stats just the other day, whereas type 2 diabetes is 21 million. You know, so again, different, right, in numbers, but ultimately treatment is what we're looking at and how to, again, help patients. Yeah,
and Tatiana, in the meantime, you do live with type 1 diabetes, but you also help patients in the meantime who are navigating their own issue. How do you weigh that in your day-to-day job and the advice that you're giving folks?
Well, you know, the most important thing is that I was a type 1 diabetes person before I was a nurse. So to me, that bonding is there, that passion is there, so I can identify with the struggles they have. Whenever they come to me and they're saying, hey, I don't know how this food is affecting my numbers, you know, so it's always encouraging to be able to have that bond with your patient and follow up with their struggles and make sure that you're giving them the right feedback so that they can make it a personalized, you know, care for themselves.
What are some warning signs you might say for people who might be pre-diabetic?
Sure. So type 2 diabetes is a little bit of a slow motion disease. So it does come in slowly, but you do notice, you know, the extra thirst, also the extra hunger. You might notice the wounds are not healing well, and people can be undiagnosed for years. And then that's how they develop, you know, possible complications even before they know they have type 2 diabetes. So
go ahead.
Well, and it's important to check those little signs, because one or two of these are not exactly a warning sign, but if you have a cluster of them, then maybe you need to follow up with your primary care physician and have a check.
How major of a role does DNA play in that?
I mean, so one thing just to follow up though, and I'll go back to what you said, sometimes with prediabetes there are no symptoms. So surfacing and precipitating like what's to come, I think it's important to know your numbers and check in with your doctor to have those visits to stay on top of it, to have the early warning signs. If we see a fasting blood sugar that's elevated, we can run another test to see their average in 3 months. And that again is within type 2 diabetes precipitated by the pre. That's our pre-moment to take action and really see what's going on. Okay. You mentioned just genetics, right, Kendis? And I think again that's another important part when you look at both type 1 and type 2, as those can be other factors that play into how, again, you may have an extra risk associated with it, but genetics do play a role for both.
They do, okay. All right, so if like my dad was diabetic, I might want to look at the numbers very carefully.
Maybe more often than a person who doesn't have that family history.
Okay. Yeah. Has, there are a lot of conversations have come up because of Ozempic. It has fueled, again, so many conversations about diabetes and other similar brands to Ozempic that are medications that are used to treat diabetes but are now being used off-label for weight loss. How do they work for diabetic patients?
Yeah, so when you're looking at someone with type 2 diabetes, one of the indicators in those medications, they work as a classification based on an active ingredient that they have in them. Yeah. And what we're looking at is something, it's an acronym, we don't need to go into the exact mechanism of how they work, but it's a GLP-1. And what that function plays in somebody with diabetes is it's gonna send a relay to their brain and helping with hunger cues, helping them to connect and cue in on their appetite and fullness levels. Yeah. It also helps what we term a level of blood sugar 2 hours after, so that postprandial effect of a meal. And it also slows digestion. That's helping with the relay to let them know they're full. Okay. But again, also ultimately one of the other side effects we've seen is weight loss. So some of the medications, those GLP-1s, are for sure for type 2 diabetes, and there are some for specifically weight loss. So it's important to speak with your healthcare provider, have the conversation, see if that is something that is for your treatment plan, right? And having those open conversations to see if you're a candidate for it.
And are you noticing a lot of patients that are saying, listen, we're having a hard time finding this drug that's so much needed? Do you find a lot of patients saying that at all?
Yes, that is happening quite often. The supply has not kept up with demand. Yeah, for sure. But the main thing is to make sure it's an appropriate medication for that patient. So, because a lot of the times the insurance companies are looking at that, but also for their well-being, you want to make sure that that's the right patient. They're going to benefit from the therapy. And
there are different forms of treatment. Like for you, on a daily basis, you have your own, what would you call it?
I have an insulin pump, and I have a sensor that communicates with it and gives feedback based on the blood sugar levels that I have. And it gives me a certain amount of insulin as I go through the day based on food intake and stress and even lack of sleep. So there are many factors that go into type 1 diabetes.
And it's a danger. It is. It really is. It is like a throwback to pager days.
Yes. But Kendis, just to tag on, I mean, that's her treatment line. Like she's the brains behind the pump, helping to know how much to dose. Yeah. And we didn't totally talk about like eating habits, but again, the importance for this and within type 1 is to make sure someone's dosing that insulin based on, Tatiana mentioned right now, stress is another factor. We focus on food so many times. It's really important to kind of, again, factor that in, but also, again, making sure the food is covered, so to speak, with the insulin she's dosing.
And you mentioned there are like 3 easy ways to remember what you need to maintain when it comes to movement, meals,
and medication.
And medication. Those are all that you have to think about on a given day, right?
For sure. For someone with type 1 diabetes, I still want them to eat healthy. There's always increased risk for heart disease within type 1 and type 2. However, with, again, type 1, the insurance is that she's making sure to dose the insulin because her body's not producing it. Remember, in type 2 diabetes, it's important to make sure that they're helping their body respond to the insulin and making it work better. Movement is like medicine. And the more that they move, the more sensitized that insulin is and able to work. And for sure, food. As a dietitian and diabetes educator, it's one of our hot topics all the time. How do I improve what it is that I'm eating in order to, food's so much more than just fuel. It's cultural, social, celebratory, all of those things combined. And it can make sometimes navigating the condition of diabetes a little tougher. It
makes navigating the 6 weeks or so between Thanksgiving and Christmas and New Year's hell for many, I assume, right?
Yes.
It's a challenge, but everything's a challenge when you're dealing with this. There are several myths surrounding diabetes in the meantime, and one of them is that if you are normal weight, you won't develop diabetes, and conversely, if you are overweight at the same time, you will most definitely develop diabetes. Is that true?
Not quite. So we do have a genetic component to these diseases. Now, of course, if you're going to develop, can depend on your lifestyle. It can depend on how much you move, like she said, the food you eat, and overall how you take care of your body. So you see now people who are pretty slim built and they are still diagnosed with type 2 diabetes. So there's a strong genetic component to that diagnosis.
Yeah, and doctor, so many people associate diabetes with older generation. Why are so many younger people being diagnosed with it right now?
So I think it speaks back to what we were talking about. It's the insulin and the resistance. And so why it's occurring, we look at diabetes, type 2 diabetes, as a metabolic disorder. And so it's really getting to the heart of what is the issue with their resistance. And so we may tackle it from, like I said, moving more, looking at the food and what they're ingesting to be able to make a difference. And kind of, again, I look at the plate kind of like as a peace symbol, so to speak. You're looking at some high quality carbohydrates, some lean protein, and then I look at it for fiber. And all of those play a role in being able to help manage the diabetes, but it's back to the insulin resistance. And so we're seeing in teens during puberty a different range of hormone levels that is also contributing to this resistance. And that's why we're starting to see it earlier and earlier.
I'm curious why Hispanics and Black Americans are more predisposed to diabetes at the same time.
I think, again, there's that genetic trait that we're talking about. Again, if I could pinpoint it, I would, right? It's also prevalent in Native Americans, right? So it's something with the genetics. And then also, again, coming back to why is it, again, more predominant in somebody possibly based on, again, movement and that insulin resistance. We need to find out why and what's happening within their genes and their response.
And how do you personally navigate the holidays when it comes to this?
So I'm more mindful, but I also give myself a little bit of slack. There is such a thing as diabetes burnout, and it is very prevalent on the diabetes population.
What is that?
So whenever you are closely monitoring a disease like diabetes, it can become taxing. So you do get that fatigue and you don't want to follow up on the disease as often. So whenever you have the holidays, when you have so many things going on, the foods and the events, the stress, that play a factor in your blood sugar levels, you need to be forgiving of yourself. So I think I give myself grace.
You give yourself grace. It's like you're okay.
Yes.
So is that what tip you would give anyone
give
who's newly?
Grace. Yes.
Okay.
Yes, and make sure, of course, we still want follow up. It's not a complete forgetfulness of the disease, but it is allowing yourself to be human and to have maybe, if you have that meal, that's fine. Just be mindful of where that's leading your numbers. Okay. So it's mainly getting to know your body and how you're going to respond to the holidays.
How many years have you been diabetic?
So 20
plus.
4.
Wow.
Yeah.
So from birth.
Thank you.
But I mean, the technology has evolved over that time, hasn't it?
Oh, absolutely. And I consider myself so lucky to live in this time when I am able to have, a device that actually gives so much feedback to myself and allows me to make better decisions based on every 3 minutes, every 5 minutes, I get a number.
It's real-time data.
It's real-time data.
That's unbelievable, something we didn't have a few years back.
And where do you see the technology? Is there something out there that we don't know of right now that will help revolutionize this?
I mean, I think, again, where we were talking about type 1 diabetes, for me, it's kind of looking at it more from the idea of, can we find a cure, right? You know, and coming back to why is this autoimmune disorder happening? And same on the side of type 2, like you mentioned, the genetic and identifying different traits that we can say, hey, what can we do to be able to, again, hinder, hold off, stave off? Okay. The only thing I did want to add, Tatiana was saying giving herself grace. One thing that's really important is I think sometimes it's similar with food. I find that patients will judge the number. And I know as an educator, and Tatiana and I have talked about this at length, it's kind of like, don't judge the number. It's more like an understanding of it, to be able to say why and what happened, and I think that's coming back to the understanding of it and maybe sometimes thinking about it too much. That's where you mentioned
and that's
grace.
Basically, a number is a number and to interpret it. Right. Like what's the context? Were you also stressed? You also, there were so many other factors that play into that number, and that's when that device leads to you you making that decision of where you're going with the treatment.
All right, let's go ahead and get some of the more top Googled questions that we see on the internet when it comes to diabetes. What are the risks for diabetes?
So coming back to type 2 diabetes and looking at risk factors, we mentioned some of the ethnicities have a higher risk and prevalence, but also looking at age. As we're aging, our organs age, and unfortunately they do not work as well. And so again, it's kind of tapping back into knowing your numbers and staying in tune with where your numbers are at so you can watch them over time. And again, the family risk is another one. If a female has had gestational diabetes, it's another important kind of indicator. A few years after, there's that prevalence of them surfacing with type 2 diabetes. So again, staying on track of it if they've had it during pregnancy. So those are just a few. And then if they're not physically active as well.
Okay, and do you try to be as physically active as possible as a result?
Absolutely, and it's always a balance, right? So whenever you are monitoring your numbers as closely as I am, you actually can plan that ahead. You can actually, stop insulin, stop treatment, go and be active, but those are all judgment calls that you do based on learning your body.
One of the more commonly Googled questions as well is, can it go away once you've gotten this diagnosis?
So again, distinguishing between type 1 and type 2. Type 1 is autoimmune, so no, it does not go away. I would say early on, sometimes their pancreas may still produce a little bit of insulin, so that can be sometimes a, confusing part, right, in the initial diagnosis. But type 1, it does not go away. Type 2 diabetes, again, if it's surfaced, it can continue. It works on a continuum. So what's important and what we look at in the terminology is, how do I manage it? How do I keep it within the range of the numbers to help it stay within the range where it should be?
And in the meantime, does diabetes cause blindness? Is that a misconception, urban myth, or what?
I think for me, the way that I look at it, diabetes is what I just was talking about, numbers, right? Keeping them in a range and helping to have too high an excursion outside of what could induce what are complications. Diabetes can affect us from our head to our toes. And I think, again, it's looking at ultimately the management of it to make sure that we're aiming to do what we can and within our control to be able to manage it and offset any complications, blindness, or whatever the other complications might be.
Yeah, and I think it's important to not let fear be a paralyzing factor in your life if you live with diabetes in general. So knowing the complications are important, but also addressing the things you need to do to prevent them.
Okay. All right. Did you want to add something?
No, that's perfect. I think it's being aware and then taking action.
Okay.
Yes.
All right. Well, this was a great discussion. Really appreciate it. Thank you guys both for being here. Appreciate it. Remember that be sure to hit the subscribe button at the bottom of the screen on our channel here to keep up with the very latest from Baptist Health and wellness information and tips from our experts. And you can also connect with us on our social media platforms as well. We're on LinkedIn, Facebook, TikTok, as well as Twitter and Instagram. And check out our resource blog as well for the latest news, baptisthealth.net/news. You'll find a link to all of the episodes right there. So stay healthy and stay safe. Thanks for joining us.